Since Colorado and Washington legalized marijuana, this year half the states are going to consider similar legislation.
But will legalized pot come to Wisconsin anytime soon?
Audio Jungle.
Gary Stork stands in the rotunda of the state capitol, hoping state lawmakers will see the medical marijuana issue through his eyes.
Not only has helped me save my sight, but it's also helped me deal with other medical conditions.
As a glaucoma patient, he learned in the 1970s that smoking cannabis reduced his eye pressure and helped save his vision.
And I've been using cannabis every day since then.
Stork has become Wisconsin's leading advocate of decriminalizing marijuana.
And the truth is, I do believe it should be legal for all use, but I also think that that's, in a place like Wisconsin, not likely to happen quickly, and in a lot of places, and that job number one should be to get the patients off the battlefield. You don't want to be arresting people who are seriously ill for their medicine. I don't think anybody wants to do that. So I think it should be legalized for medical use.
But being a glaucoma patient is a challenge. Surgeries are not without risk. Medications may have local or systemic side effects. Even the medication you put in your eye, you don't think of it as getting into your body, but it is getting into your body. So it's a tricky business. But at the moment, the only therapies we have are lower the pressure, drugs, lasers, surgery. Cannabinoids do lower the eye pressure. Sounds good. They do lower it, and they're probably not as effective as the most effective drugs that we have, but the effect is enough that it could be of value therapeutically if it lasted longer. It just hasn't gone very far, not because people in my community, my professional community are against the idea, but because it's just a lousy drug. I mean, if you're trying to say just measure us by the standard, measure cannabinoids by the standard that don't prejudice against it, let it go through the normal process, which by the way has always been the policy of the FDA and NIDA and the NIH. If you came up with something that passed muster, the fact that it was cannabinoid as an eye drop would not be a deterrent. But nobody's been able to do that, and so it's amusing for me as an ophthalmologist and a glaucoma specialist to hear patients, not patients, advocates argue passionately to allow the use of marijuana for the treatment of glaucoma.
It is really amazing, and it's terrible it's taken this long. If I'd had any idea in 1995 or 97 that 17 years later I'd still be trying, I would have left a long time ago, I think. But
one Democratic state representative has introduced a bill that would legalize marijuana in Wisconsin.
This is not a piece of legislation that I put forward lightly. I put an awful lot of thought and did a lot of research into it because I know it's a topic that's going to be very controversial. Many of the other drugs that are on the same class as marijuana currently at the federal level, those drugs are hurting people. And they're hurting neighborhoods and communities and pulling them apart. Marijuana does not belong on that list. And we've created a narrative that makes it seem like a very scary substance. But you start breaking it down and you realize that's not the case. My hope is that by introducing this piece of legislation, that we're able to dispel some of the myths and we're actually able to bring to light that the most dangerous thing about marijuana is that it is illegal.
Among state law enforcement, the consensus is that pot is a gateway drug and should remain illegal.
If I had to make a well-educated guess, I think I would say probably about 20% of our, maybe 25% of our time ends up being involved with marijuana investigations. I believe, based on my everything I've seen, that there are thousands of pounds of marijuana coming into the Dane County area every year, whether it's 2,000 or 5,000 or 8,000. But there are hundreds, I'm confident there are hundreds of people getting pounds at a time. So, and often quite regularly, every week, every month, something like that. So it's a lot. Because of how valuable marijuana is in this marketplace, and because I think of what's associated by a lot of people with it, it's a low risk drug in terms of its damages to health, and I'm not a doctor, I'm not going to opine on that. And it's culturally accepted, certainly in this community. It's a young college. There's a lot of factors going on there, that the quantity of marijuana coming into the greater Madison metropolitan area has exploded. So we have, as a unit, we believe that marijuana generates a significant amount of violent crime and firearms-related crimes, because criminals go where the money is. There's a lot of money in heroin because of the demand, but there's a lot of money sitting around because of the marijuana. And, oh, by the way, the people we're going to be stealing from, for the most part, aren't predators, so they're easy victims. And, by the way, they have a lot to lose if they report it to the police. So you have this kind of perfect storm. So that's kept us in the marijuana interdiction business.
As states began to legalize it for medical use, people in Wisconsin began to leave. And a number of good friends of mine left for places like California and Oregon, and they've fled. And we've had a tremendous brain drain.
I don't think you're going to see anything serious anytime soon here, but if other states did, maybe in the next legislative session there'd be more talk.
I don't know why it's so intractable. It's extremely frustrating that we can't get any traction, and part of it is that Republicans are so against it, but Democrats haven't come forward and stood up in enough numbers for it either. It's just been revving up and revving up, and the only time I've ever seen it close to this was in the early 70s, when there was a lot of talk of legalization, and the Schaefer Commission had reported, and things like that. But now it almost seems like it's unstoppable.
I see a number of topics kind of traveling our country as people are starting to think more about personal liberties. And I believe this is near the top of that list. We're not hurting ourselves. We're not hurting our neighbors. And I think more and more people are realizing that the most dangerous thing about marijuana is the fact that it's illegal.
And even though at least certain counties are highly supportive of it, there are enough counties that aren't, and there are enough people who are controlling the gears of government that right now I don't see a lot of support for it.
I know that my bill as introduced needs to change. I already have some really good feedback on ways to improve it. And that's what the whole process of legislation is. You introduce it, you have conversations with people in the community, with leaders, and you keep working on it. And I'm going to continue working on this. Do you feel that?
The times are changing, and people really, I think Colorado and Washington really pushed it over the edge. And now that you can get in your car and you can drive 16 hours and go there and go to a pot store and buy pot, it's a whole new game, I don't know. Things are moving so fast that I think, Wisconsin should consider it, and that there's a lot of benefit.
Audio Jungle.